Hey guys, it's Shalisha and I am back with another video, and I'm going to discuss today like withdrawal symptoms, like withdrawals, detoxing, like once you've had like a binge of alcohol, or maybe not really a binge, but you've drank every day like for a week, and then you just, what happens after that when you're an alcoholic. And if you don't know me, I'm Jalisha and I am an alcoholic. It's been a rough journey, and I plan on doing a series of my experience, my journey through battling alcoholism, because it has really been a significant hit in my life, is what I would say. It's a lot, and it took me a minute to admit, that I was. But once you do, then you get help, and then you're fine. Well, you're not fine. Just kidding. Just kidding, guys. Just kidding. Unfortunately. Anyways, so today's topic is going to be, like I said, withdrawals and detox. And I have my little notes down here because, and these are all the symptoms that I have experienced myself personally. I just didn't want to forget anything, because I want to be able to help at least one person out there that is struggling with alcoholism, or thinks that they do overdrink at this point and they're scared that it's going to go into alcoholism, because it's a very serious disease. And yes, I said disease because it is. Alcoholism is a disease. And speaking of the withdrawals, it is actually, and they consider alcohol a drug. I've never been addicted to any other drug, thank God. God, please don't. I don't know. I couldn't do it. But anyways, so yes, when it comes to withdrawals, it's actually one of the most dangerous drugs to withdraw from by yourself. You actually need medical treatment, like to withdraw from alcohol. Once your body's addicted and you experience like these symptoms, you would definitely need to go and be seen. There's a medical way that they actually give you an IV. I've been in the hospital so many times. Alcoholism is a beast. I've been into the hospital, so many different hospitals, a lot, and to the point where they knew me, unfortunately. Yeah, because I wanted to be safe, because you literally feel like you're dying. When I say you feel like you're dying, I don't even know, I've never died, but you know how you feel like you're gonna die? That's what it feels like. So this is a list of withdrawals, starting from, because I believe that alcoholism progresses, right? So at the beginning of alcoholism, it's just like you have like the regular like they call it a hangover. They don't call it withdrawals. They say hangover. So at the beginning, you get the hangover, where you have a headache. You don't want to see like the bright lights the next morning. You're sluggish. Some people drink coffee. Some people drink more alcohol to help the hangover. I mean, I'm not judging. But yeah, so that's what initially happened, because I started with box wine. I think Franzia. I still can't fucking say it. Franzia? Anyways, that's what I drank. And it started off fun, all shits and giggles. And then it got serious and went to vodka. I didn't just go to like a couple shots of vodka. I went to a fifth of vodka a day. A fifth of vodka a day. And I had bariatric surgery. So I should not be able to consume that much and still live. But here I am. Want to do it? Anyways, so yes, like I said, so the initial thing was like headaches. And then it progresses and you get tremors. Tremors is the shakiness. Like if you see someone's hands, like just tremoring, So that'll happen. That happened. It still happens to this day. I don't see this day because I'm good now, guys. I'm good. But no, it still happened like throughout the journey. The whole shakiness, the tremors. It's a lot. It's scary. That's not the scariest. That's like actually the smallest. Okay. So you get hot and cold, literally. Like I would have I already still like a big old fan on my face, but I would have like a little heater, literally both of them plugged in right next to me, because I get hot and cold. Then I'd have the night sweats, and I'd wake up like just profusely sweating. Gross, I know, but it is what it is. Angina means chest pain, heart pain. And I get that with anxiety typically, but when it comes to withdrawals, it tends to get a little bit more serious to where it's kind of scary. And I've had a few medical issues, like a pulmonary embolism. I've had a TIA, which is like a small stroke. And so anxiety mimics those things. And when you're going through withdrawals, and with it being the most deadliest withdrawal, like drug, I guess, yeah, it's scary. And so that's why I've been in the hospital so many times, because I'm like, oh my God, I'm gonna die. Like, I feel like I'm dying. And so, and then I put jerks. One of my jerks, and I found this out by a doctor. So potassium, we all know potassium. Your body needs it. And potassium actually feeds your muscles. Your heart is a muscle as well. So when I would go on bingers, I would be low in potassium and magnesium, probably a shit ton of other things. But I would jerk like my leg was like, and I already have like restless leg syndrome. And if you don't know what that is, Google it, or I can do another video on restless legs. I have a bunch of shit. It's fucked up. Anyways, so yeah, like you just like jerk, like anything. You look like a crackhead, pretty much, you know? So yes, the jerks. General weakness. Like, I found myself, like, if I was withdrawing, I would try to go up like a small step. And I would have to like hold on to something like to get up that small step, because my legs felt like shaky and weak, and I just felt so off. Nausea, of course, that actually comes with the beginning of, you know, like when you first start drinking. But nausea, oh God, you just feel like if you throw up, you'll feel better, but that's not really the case at all. Skin rash. I don't even know if this is like a normal thing. I'm not a normal person. My life is very different and unique from a lot of other people. So I would get a skin rash. And what I mean by that is not like an itchy, like chickenpox rash, but like discoloration. I guess you can say discoloration. But it would be slightly raised and red. And sometimes it could be head to toe. Sometimes it'd be half my face. Sometimes it would be a patch on my back. My body just, I don't know, it does what it wants to do. Okay? So, itchiness. So I found out itchiness recently. That itchiness is actually a symptom of your liver starting to get sick. Sick of your ass, pretty much. Because the liver, you know, it's your filter. It's like, you know when you have like a thing of water in the refrigerator that you put water but it has a filter in it? The filter is your liver, okay? So it gets tired, and but it makes you itch like really, really bad. Oh my gosh, I hate itching. I hate itching so bad. It's so annoying to me. Diarrhea. Yeah. But it's crazy because it's either diarrhea or constipation. You never know which one you're gonna get. Okay, like Forrest Gump. Yeah, the chocolates. You never know what you're gonna get. That is totally how it is. Diarrhea or constipation. You never know which one. Dehydration, of course, because when you drink, I mean, it's absorbing this. I know there's a lot of salt and shit in there. And you're not really drinking a lot of water. You're drinking a lot of alcohol. And you're dehydrating your body. You're depleting it from a lot of electrolytes and a lot of the good shit you should be getting. Vitamins. Food. So, dehydration. Pain and achiness. So the pain, I would say, like it would be chest pain, headache, of course, just body achiness. Like once you get to a certain level of alcoholism, you just ache. Like, and then pancreatitis. That's also my list. So now I have chronic pancreatitis. That shit is painful as fuck and will send you to the hospital immediately. It hurts on your lower, like right underneath the rib cage on your left side. And it hurts so bad. And it's dangerous, actually. So if you leave it untreated, you can actually go septic. You can die, okay? A lot of shit that alcohol can cause, you can die. Not cool. So, after all those symptoms, that's when, I guess, after 6 years, you become a pro at withdrawing, your body says, and It goes into delirium. We're talking about delirium. I think actually before that, I think it's the seizure. So I've actually had a alcohol withdrawal seizure. The hospital called it, thankfully. It's when I was living in Indianapolis by myself, just going ham with alcohol, just being depressed, anxious, whatever. And I would call, like, when I feel like I'm gonna die, I call the ambulance, of course. And yes, they witnessed a seizure, so that is on my medical chart. Ugh. So that was like my first seizure ever. I don't even remember it, honestly. I just know it was documented and told by the nurse at the hospital in Indianapolis. I think it was the Avon Hospital, Avon, Indiana. So that was scary. Then after that is the delirium. And I was wondering why, like, whenever I would go to a different rehab that I would self-admit, I've never been court ordered to go to rehab, I would always self-admit myself, because I've always wanted to be, you know, back to my old self, because alcoholism is a beast. It's not cool, not fun, actually. I mean, maybe initially, but it's the devil, and you hate it. You hate it, but you still drink it, and I can't even explain it. But yeah. So I would wonder why they would always say, like, have you had any hallucinations? Like, asking me about my symptoms. Like, as far as going to the hospital when I was having, like, the shakes or the jerks or the itchiness, or, you know, like, when I would go to the hospital for that, that was a question. Like, have you had a hallucination? Have you had a delusion? And I'm like, bitch, I ain't crazy now. But when I went on my longest binge, I think it was probably 7 days straight, every single day, like drinking from sun up to sundown, sleep, and then barely eating. Once I started, like, when I stopped drinking and started the withdrawal symptoms, initially it was the shakiness, the hotness, the headache, but then the hallucinations came. Okay, your first time, you really don't know they're hallucination. You really don't know. So in your head, like, you feel crazy, like, is this really happening? But you really, like, you physically see it. You see it, you hear it. Tactile is when you feel it. Like, it touches you. Feel like you're, like, whatever you're seeing, you feel it. Oh my God. I've had 3 different experiences. The first time I said I would never drink again in my entire life because that was so fucking scary. It was the worst nightmare of my life, and it was in real life. But good old alcoholism is like, hey, excuse me, knock knock, I'm back. Can you drink me? That's how it is. Anyways, so I had a really bad experience earlier this year where I thought, like, I had gotten to the so the night before, I always, like, clean my ears. I'm a clean person. Like, I like cleanliness. So I'm always cleaning my ears and my daughter's ears, and I used to clean my boys' ears. But anyways, so I was cleaning my ears, looking in the mirror, make sure, you know, I don't have any blackheads or anything. That's gross. And I was hallucinating that there were spider eggs in my ear. Okay. So I'm, like, recording this shit on my phone, like, oh my God, I have all these spider eggs. Like, should I go to the ER? Because if they crawl in my body, like, and I'm being so dead ass, so serious. And I remember sending it to my friend, like, do you see this shit? Like, oh, look at all these spider eggs. And they're like, I don't see nothing in your ear, girl. But I still believe that. So I made an appointment the next day to an urgent care. I remember it was at 9 p.m. because I remember I was like, damn, they're open until 9 p.m. So I made an appointment because I was going to go see my daughter in the NICU. That's like an hour and 10 minutes away. So yeah, I had even made an appointment. Okay. So I go the next day, go see my daughter in NICU, whatever. That was a full day. And then I come home. I get in the shower. I get out the shower and I see, when I tell you, and I'm not exaggerating, this spider was this fucking big. It was hairy. It was angry. So I'm walking out of my bathroom, and directly across my bathroom, I can see my room door, right? I see this big ass black spider, like I said, this big. Yes, like twice big as my head. And it was, like, angry. So in my head, I'm thinking, okay, that's Mama Bear trying to get her eggs out my ear. It sounds fucking crazy, I know. But this is what alcoholism does to you, okay? I'm so glad that I can laugh about it today, because at the time, you are terrified. You're mortified. So I jump on, so I seen it out there, and then in the bathroom I seen it, like between the shower and the sink. I seen another one. So I jumped from my shower to the toilet. Almost fell, didn't fall. So then the next room would be my dining room, then my living room, and then my bedroom, but you can see kind of through, like I said. So I do the toilet. I'm so scared. I like jump. It wasn't even like I was jumping over, because at this point I'm standing up on the toilet, and this thing is like on this side of me, right? So I don't know why the fuck I jumped, but I jumped, and I fell flat on my face. My poor face has been really through it. I am so glad that it is symmetrical at this point, because my face has been through it, okay? So I fell flat on my face, hit my collarbone. All I could do, I didn't grab my phone. Like, so I had 2 different phones. Like, one that's not in service, but it's an iPhone, so, you know, you can kind of still contact people. And then I had another phone. And so I grabbed the one that was not in service, but you can still call 911, I figured out. You can call 911 on a phone that does not have service, guys. Fun fact for you. So, yes, I called 911. I grabbed a thin-ass robe that I have in my sight. It was a thin-ass black silky robe. Here I am, butt-ass naked, out the shower, running outside, running and calling 911 saying, hey. And I said there's someone in my house, because if I would have said there's big-ass spiders, they wasn't going to believe me, even though I seen them. So I'm like, I know it's real, but is it really real? Because this shit is crazy, right? So I have a convenience store, like 2 or 3 houses down, like 2 or 3 houses to the right. So I'm in this thin-ass robe. My hair is like all curly and wet. It's cold as fuck outside, no shoes. I'm that scared. It was that scary. And then I started feeling like spiders coming out of my ears. Oh my God, they probably thought I was a crackhead or something. Like, they probably thought I was on drugs. Because I called 911, I go to the convenience store, I run in there, and there's an older man in there, and the worker. I said, oh, do you not see these spiders? Or they're like, follow me. Because I'm visually seeing these spiders. Excuse me, not the mama bear spider, but it was like little clear, crystally, I don't know, looking spiders, but they're huge, and they're chasing me. And then now they're in the store, and now they're like underneath the counters and stuff, and I'm like, you don't see that? So the store, the cashier called 911, and I was like, I already called them, I'm waiting on them, I need their help. So they get there, police officer, he was very kind, and I let him know. I was like, there's spiders. And then I seen, like, they got me out of the convenience store, and I know I done flashed a few people, oh God, on the road, and it's a busy road too. Yeah, So they got me to the ambulance, and I was like, oh my gosh, I have no shoes on, like, can you get my other phone that actually has service, like, can you, I said, because I'm visually seeing the mama bear at my screen door, hugging it, screaming. I know, it sounds fucking crazy. Research. Before you think I'm crazy, do your research. I'm telling you, this shit's real, and it's scary as. So, yeah, I go to the hospital. They take you to the, I call it the psych ward, but I don't think it's really called that at Ball Hospital or any hospital, unless they probably do have a real psych ward. But this is the ER part. So, but it's the part where people are saying, I'm going to commit suicide, or I'm going to commit homicide, or they're just like having a mental breakdown. That's where they take you, and you have to wear this gown, a paper gown, and the sheets were like literally rippable. Like, when you lay in it, and they were just ripped by themselves, right? And I'm still seeing these damn spiders. I don't want to lay in the bed because I see spiders in the bed, and you get like this person called a helper. And they sit in this rolly chair, and they just sit there, and they look at you like, bitch, you're crazy. And at the time, I felt fucking crazy, because I knew it sounded crazy, but I'm visually seeing them. So I'm like, I can't be crazy, because I am literally visually seeing these things, right? I'm not crazy. I was discussing withdrawals and detoxing from alcohol, and the significance of it, the dangers of it. and how you really, if you're really going through withdrawals, you need to go to the hospital because it is a medical emergency. They do consider it a medical emergency. But I had just got off the topic of I seen these big ass spiders. I was hallucinating, and I seen them, but I looked crazy. They probably thought I was either crazy or I'm on drugs, and I hadn't drank in a few days. And so the delirium and stuff happens 3 to 5 days, I believe, I want to say, after you stop drinking. And so that's why I was so confused. Like, why do I feel crazy? Like, did I just snap? Did my body just snap? That's what it felt like. So I'm on the ambulance, right? And they had a cop ride with me to the hospital because I was that, like, I wasn't combative and I wasn't mean, but I was scared to fucking death because these spiders are huge. And now I'm in the cot in the back of the ambulance, and I look up, and where they have their supplies, like right above the door, like when you come into the ambulance, it looked like Papa Bear to me, okay? It looked like Papa Bear and his little army. That's what I was seeing. And they were pounding they were trying to pound through the glass, and I was like, and I'm telling these people, like, I'm scared as shit. And then, of course, because since I'm hallucinating and they didn't see it, they're making jokes like, here, let me cover you up. Because, again, I only had a thin-ass silk robe, black robe, short as hell, nothing under. I was butt-ass naked. I ran from the shower. So they're like, if you cover yourself with this sheet, maybe the spiders will go away. So I had to cuss them out and let them know. I'm like, listen, I got more education than you because I'm a nurse, and I've been one for years. I'm a seasoned one at this point. So don't insult my intelligence. And I was being so serious, but now that I look at it, I look so crazy. Like, I wish I knew who that was so I can, like, get a hold of that person and be like, I am so sorry. Because I was going through it, okay? I would totally apologize. But yeah, so you get to this bed or this unit in the hospital, the ER. Everything's like paper thin, plastic, because they didn't want people to kill themselves or others. Yeah, understood. But once they realized that I had a history of alcoholism and that this was a more serious withdrawal, to alcoholism, they admitted me within like 30 minutes, I would say, from being on that floor, and they took me up to whatever floor I went to, and much more comfortable bed. And the girl was like, well, they should have been had you up here because you don't belong wherever they have me. I don't know. And once they gave me, no lie, like, they either give you Valium or Ativan, and that's a benzo. And so that kind of acts to, how do I explain it? So the benzos actually kind of act like alcohol to your body, but it's a much safer taper to get off of alcohol. So like initially, and I know a lot of other alcoholics try to taper off their alcohol, which means either they try like a lower alcohol content and then try to drink like less and less, and then like, okay, that's still dangerous. Actually, that's what they try. They do the benzos, or if you're in like pain, like I said earlier, like in the different video, like your body feels so achy, like kind of like a flu. Like you just feel like, and especially from the jerking, like the weird involuntary jerks, like you feel like you've been to a workout like 10 times is what it feels like. That's scary. It affects your memory. I was confused at one point. I had to call the ambulance because I was confused. Like, and it wasn't just like, oh, I just walked into the kitchen. I forgot what I was going in there for. It was more. I remember one night I had to call 911 because, like I said, I've been a nurse for a long time, and I also have chronic hypertension, and so I'm on 2 antihypertensives, and I have an automatic blood pressure cuff or machine, and so I always check my blood pressure, especially like if I get a headache or something, like I check it, and then I know to take like an additional antihypertensive medication to get it lowered, right? So that night I tried and I couldn't figure out how to get on my arm. And when I tell you, I was like, I Googled the shit. I was trying. I was like, why is this not working? It's not working. It's not sticking. Like, what am I doing wrong? I'm following directions. Mind you, I do it every day. It was something that I knew how to do. So the fact that I was scared. So I was like, it's not sticking. So then I try to hold it, and then it would pop off, And so I'm really into like crafting and stuff. So I had some Velcro strips in my crafts. And I have a sewing kit because I know how to sew as well. So my ass tried to sew. First tried hot glue. Hot glue wasn't doing it. It would just pop off. So then I went to sew the Velcro strips in it, so it's going to stick. It's going to take my blood pressure because I was worried because I'm confused. And not even thinking that once you puncture that blood pressure cuff, it's done. Like, there has to be air in there. It has to blow up to check your blood pressure. If that tells you how confused I was. So once I done that and realized I done that, I called 911 immediately. I was like, something's not right. And I was honestly scared of, I didn't even think it was withdrawals. I thought that I was having another mini stroke because I've had one. I had one in 2022. So, and that was one of the symptoms with that, is I was like kind of confused. And I'm just like, you just feel like, what's going on? And it's kind of like when you see a dementia patient and they're getting more and more confused and they know that they're getting confused. That's the worst, is when you know you're getting confused. And for me, that was scary. So I go, yeah, and of course they do the whole, they actually typically give me Ativan at the hospital to taper off, but sometimes the hospital was out of Ativan. I'm not sure why. Valium doesn't really work for me. I'm not sure why, but it doesn't. Like, I still feel the symptoms of shakiness, and it's pretty awful. Also, after binge drinking, my tongue starts to bleed. I don't know if that's because I'm anemic and I have 2 blood clotting disorders, but it only happens if I have been drinking for a long time. Hair loss. I had done the big chop in like 2011, 2012, and to like 2 inches. My hair was like 2 inches. Cut all the perm off. And I grew until waist length. Like, I could pull a curl down and I could pull it to my waist. Now, yeah, very thin, bald spots. It's about the length of, this is a wig, but it's about the length of this. My hair is, but way thinner. So it causes that, of course. Jaundice. I really haven't experienced jaundice too much, thankfully. And jaundice is just like yelling of the skin and the eyeballs. And that tells you that your liver is trying to fight, because your bilirubin is fucked up. That's a lab. That's a whole nother video. But I would get pitting edema. So edema is swelling, but pitting edema is when you put your finger, and if you're swollen, you put it there and your fingerprint stays, right? And they, like 1 + 2 + 3 +, that's the second that the indentation stays in your skin. Oh my gosh. Like, when I say from my groin down after drinking for a while, I would have pitting edema, and it would last for a good 10+ seconds, and that's not good. That was one thing. Moon face. Moon face happens to me every time I drink. And so pretty much they call it moon face because your face, I just swell up like Mrs. Puff off SpongeBob. But it's just like your face swells and it looks like a moon because you're so puffy from the alcohol, dehydration, all of that good stuff. And then I actually diagnosed with fatty liver disease. That is not like cirrhosis. It's actually a stage before cirrhosis of the liver. It's something that is reversible once you stop drinking and then start living like a healthier life. But yes, I do have alcoholic-induced fatty liver disease, unfortunately. But my labs have been good, so that's awesome. That makes me happy. And let's see, shortness of breath. That's one thing, and that's scary because that's also a sign. It could be a sign of many different, other medical emergencies. But yeah, that's all I have for this video. I have other ones coming up. My son was bugging me, asking when I was going to drop my next vid. So here you go, Tyreek. I got it for you. I can't wait to talk to you guys soon, and I'll have another topic. Have a good night.